constant exhaustion, body aches, muscle stiffness and pain? Do you have insomnia? Can't think straight? Or even have irritable bowel syndrome, IBS? All of these symptoms, or a combination of these symptoms, could mean chronic fatigue syndrome. Here to talk about this is Dr. Garabedian of the Garabedian Clinic in affiliation with the Holtorf Medical Group in King of Prussia. Dr. Dre, good to see you. Doing well, doing well. Now, this sounds like, after everything I just mentioned, like it's a tough condition to diagnose. What exactly is chronic fatigue?
Chronic fatigue syndrome is a serious medical condition that's characterized with severe, profound fatigue not related to activity. This fatigue is not relieved easily by just resting. Unfortunately, the name trivializes the condition because people think fatigue is something very common, and it doesn't give importance to the fact that there are very serious associated conditions with it.
How many people come to you and say, I'm tired all the time? Is that a start of something?
Well, it's a common complaint from many people. The issue is if this is something that started suddenly and it's getting so much severe that it cannot get influence and limit the activity of the person and their physical capabilities and mental capabilities for that matter.
Of the symptoms that I mentioned, are there anyone that are specific to, hey, this better get checked out?
Well, absolutely. One of the common ones that bring patients in is the brain fog, which we say cognitive dysfunction, which they call brain fog. Some of it is very dysfunctional sleep and unrefreshed sleep. These are very common findings. Some aches and joint pains that also start to happen. There are other problems with serious headaches and headaches that are of new onset. There are gastrointestinal symptoms, so it's a complex issue.
Let's talk about treatments now.
Well, treatments addresses the underlying issues. Unfortunately, because most of the tests have been normal, traditional medical thinking is that we don't know what to treat, and it's considered like maybe a depression or something like that. There are a lot of underlying abnormality, neurohormonal abnormalities, functional abnormalities that we test for. And if they exist, it makes a lot of sense to treat them if the patient needs to be improving.
And most treatments last for?
Well, sometimes lifetime. It's unfortunate.
I was going to ask you, is this a lifelong situation?
This is not a condition that can always improve within a few months. It is a waxing and waning condition, meaning sometimes people feel better, sometimes feel worse, but it's almost a lifetime form of a treatment to keep also always on top of it.
So your advice to everyone out there who may think they have 2 or 3 of those symptoms is to do what?
Well, at least to go and check with their family doctor or their physician or maybe a specialist to see if that is just another condition, another issue that should be addressed, not maybe chronic fatigue, but if it is not, to really deal with physicians or go to physicians that know something about it.
Dr. Dre, always a pleasure.
Thank you.
Appreciate you coming by. For more on chronic fatigue syndrome and Dr. Garabedian's Holtorf Medical Center, just go to cbsphilly.com for more information and click on Talk Philly. Let's get